Springkata. Definition. Springkata, also known as vernal keratoconjunctivitis, is a chronic allergic eye condition that primarily affects children and young adults during the spring and summer months. It is characterized by inflammation of the conjunctiva, the clear membrane covering the white part of the eye, and the cornea. Etiology. Springkata is caused by an allergic reaction to airborne allergens, such as pollen, grass, and tree spores. The exact cause is not well understood, but it is believed to involve an exaggerated immune response to these allergens. Clinical features: itchy, red, and watery eyes, swelling of the conjunctiva, sensation of a foreign body in the eye, photophobia, sensitivity to light, stringy mucus discharge, blurred vision in severe cases. Risk factors: genetic predisposition, living in areas with high pollen counts, personal or family history of allergies. Sequelae: if left untreated, springkata can lead to corneal ulcers and scarring, which may result in vision impairment. Investigations. Diagnosis is primarily based on clinical symptoms and examination by an ophthalmologist. In some cases, allergy testing may be done to identify specific allergens triggering the condition. Treatment: topical antihistamines and mast cell stabilizers to alleviate symptoms, cold compresses to reduce inflammation, lubricating eye drops to relieve dryness. In severe cases, corticosteroid eye drops under close medical supervision. Allergen avoidance measures, such as staying indoors during peak pollen seasons. Management. Long-term management involves regular follow-ups with an ophthalmologist to monitor the condition, adjust medications, and prevent complications. Patients should be educated about allergen avoidance strategies. Prevention and precaution. Minimize exposure to allergens by keeping windows closed during high pollen seasons. Use air purifiers with HEPA filters indoors. Practice good hand hygiene to prevent allergen transfer to the eyes. Avoid rubbing the eyes, as it can worsen the condition. Summary: more points. Springkata, also known as vernal keratoconjunctivitis or VKC, is a type of allergic conjunctivitis that mainly affects the eyes. It typically occurs in the summer and spring and is characterized by inflammation of the conjunctiva and of cornea. Pathogenesis. It is considered to be an allergic response to different allergens in environment. Inflammation in the eyes is triggered by an overreaction of the immune system to these allergens. There may also be a genetic predisposition to developing VKC. Etiology. Most common allergens include pollen from trees, grasses, and weeds. Other triggers include dust mites, animal dander, and certain airborne irritants. Signs and symptoms: itching and redness of the eyes, watery discharge from the eyes, swelling of the conjunctiva and eyelids, sensation of a foreign body in the eye, photophobia, blurred vision. Predisposing factors: 1. Age and gender. 4 to 20 years. More common in boys than girls. 2. Season. Most common in summer. Hence the name springkata seems to be a misnomer. Recently this disease is labeled as warm weather conjunctivitis. 3. Climate. More prevalent in tropics, less in temperate zones, and almost non-existent in cold climate. 4. Other atopic manifestations, such as eczema or asthma, are associated in 40 to 75% patients with VKC. 5. Genetic in 40 to 60% of patients. Complications: corneal ulcers or erosions due to persistent inflammation, scarring of the cornea, which can result in vision impairment, chronic conjunctival and corneal damage. Diagnosis: medical history, including allergy history, slit lamp method to assess the extent of inflammation. Allergy testing, such as skin prick tests or blood tests to identify specific allergens. Treatment: topical antihistamines and mast cell stabilizers, topical corticosteroids, cold compresses, alleviate itching and swelling. Avoidance of allergens, oral antihistamines, contact lenses. People with spring catarrh should avoid wearing contact lenses during flare-ups, as they can exacerbate the condition. Surgery in severe cases.